Hello, everyone, and welcome. Dr. Brandon Money, the golf doctor, here with the Centeno Schultz Clinic. And today we're talking about two of my favorite things, golf and medicine. Whether you're an amateur golf enthusiast or a touring professional, one thing is certain, injuries can take a toll on your game. But the good news is, many of these injuries are preventable and treatable. That's where golf medicine comes in. So, what is golf medicine? It's a very specialized approach to understanding and treating the unique physical demands that golf places on the body. It involves a team of professionals who focus on keeping golfers healthy, optimizing performance, and helping recover from injuries as quickly and safely as possible. And in this webinar today, we're going to be covering three key areas. Number one, some of the most common injuries related to golf and golfers. Number two, who you should see for evaluation and treatment. And number three, the best conservative and orthobiologic non-surgical treatments available today. Ready? Let's dive in. First, let's talk about TPI, or the Titleist Performance Institute. Now, TPI offers specialized golf training for a variety of professionals, including golf teachers, strength and conditioning coaches, physical therapists, chiropractors, physicians, and others. The premise behind TPI is to break down the body and the golf swing and figure out what characteristics of you and your swing correlate with either injuries or dysfunctions in the body, all the way from your cervical spine and your neck down to your ankles and feet. All TPI professionals speak a common language regarding your body and your golf swing. The TPI website at mytpi.com has a comprehensive database of TPI certified professionals, so you can find someone to work with that's close to you. Now, let's talk about a few common golf-related injuries. Golf itself may not be a contact sport like some of our other favorite sports around the world, but that doesn't mean it's easy on the body. The repetitive motions, explosive rotational forces, and long hours of practice and play can lead to overuse injuries. Here are some of the most common ones golfers face. Now, starting out, low back pain, very broad term, but somewhere in the lumbar spine, probably the most common golf-related injury. And the golf swing itself requires a combination of spinal movements, including rotation, lateral flexion, extension, so poor swing mechanics, lack of stability around the core, and overuse can irritate the structures of the lumbar spine. Repetitive twisting without proper mobility can lead to injuries of the discs, irritate the facet joints, strain the muscles. Some of the symptoms that you may experience are dull, aching pain in the low back. Maybe you have some radicular nerve symptoms or sciatica going down the leg. Pain can worsen after playing or prolonged standing. You can experience stiffness or difficulty bending and twisting. And now, low back pain can be from a number of different conditions, including degenerative disc disease, facet joint arthritis, disc herniations irritating those lumbar nerve roots, also known as sciatica, muscle strains, and many others. Number two is golfer's elbow, or medial epicondylitis, or common flexor tendinosis. Has lots of different names, but means the same thing. And repetitive gripping, especially with poor wrist mechanics, can put added stress on the tendons on the inside part of the elbow. It's more common in players that have a strong grip or those who practice frequently without proper conditioning. Now you can experience pain on the inner side of the elbow, worsened by any type of gripping or swinging. And you can also get stiffness and weakness when making a fist or shaking hands with someone. Now, despite it being named golfer's elbow, pain on the outside part of the elbow, also known as tennis elbow, is far more common both in golfers and the general population. Now, let's move up a little bit to the shoulder. The rotator cuff has 4 different muscles and tendons that wrap around the shoulder to help provide with movement and stability. And the shoulder itself plays a huge role in both the backswing and downswing mechanics. Overuse or improper mechanics can lead to tendinitis of the rotator cuff tendons, impingement in the shoulder, or even more damage like tears of those rotator cuff muscles and tendons. Now, you can experience pain when you lift the arm overhead or rotation of the arm. You can experience weakness, especially when you're trying to reach out in front of you or reach out to the side. Some patients will experience clicking or catching sensations in the shoulder. Now we're going to move downstream to the knee, and it's often overlooked, but I would say it's probably the most common area, or one of the most common areas, both in the general population, also with golfers as well. And the golf swing itself places a lot of torque on our forward or lead knee, which can aggravate degenerative osteoarthritis or create injuries to the meniscus tissue, for example. In addition, any previous knee injuries may flare up due to getting irritated due to the forces and stresses applied to the knee by the golf swing. You can experience pain while squatting, twisting, or shifting your weight, swelling in the knee after long rounds, or a feeling of instability in the knee itself. So now that you know some of the most common injuries related with golfers, who do you see if you're dealing with one of these injuries? Well, you can talk to golf swing experts, golf coaches. Physical therapists can help design rehabilitation programs to strengthen weak muscles, correct any muscle imbalances, also improve mobility. Chiropractors and manual therapists help focus on alignment of the body, mobility, releasing tight muscles. Strength and conditioning coaches, they're the ones who can work on golf-specific movement patterns to, number one, help get stronger, which can also prevent injury. And also, expert TPI certified sports medicine physicians can help diagnose and treat neuromusculoskeletal injuries, and they may recommend additional advanced imaging, x-rays, MRIs, CT scans, etc., if needed. Now, let's talk treatment. The best approach depends on the severity of the injury, but many conditions can be managed conservatively. Very few patients absolutely have to go have surgery. Now, looking at physical therapy, they can help strengthen and work on mobility to help heal injuries that you may have and also prevent re-injury. Manual therapists and myofascial release, including massage and soft tissue techniques, can help overall improve movement and the fluidity of movement. Bracing and taping can help support injured joints, muscles, tendons, and also swing adjustments. If you do have certain swing characteristics, we know that they have a likelihood of leading to various injuries. So working with a golf pro to make alterations in those mechanics of your swing can also help reduce injuries. Now let's talk a little bit about orthobiologic and regenerative treatments for the body. Probably the one most people have heard of is PRP therapy. PRP stands for platelet-rich plasma. And what that does is utilizes healing factors that come from your body, your bloodstream, and can help stimulate the healing process in a variety of tissues, including tendons, ligaments, joints, etc. Now, going up another level, we have bone marrow concentrate, which contains mesenchymal stem cells and other healing factors of the body, and that can also promote tissue repair, and it's a stronger treatment option compared to PRP for those who need it. Now, there are also adjunct treatment modalities such as shockwave, cold laser, red light therapy that can work in conjunction or standalone from those above orthobiologic treatments to help restore function and to reduce symptoms. These options provide a way to heal faster and get back on the course with minimal downtime. Now, don't get me wrong. These therapies aren't going to turn your severely arthritic knee into a 17-year-old knee again. But we don't have to in order for you to feel and play better. And really, that's what matters. The body has an amazing capability of healing, and the experts in this field of medicine can help harness that and use it to restore function. So, now that you have the info on golf medicine, here's what I would do if I had a lingering injury. or just wanted to learn more about my body and my golf swing. First, I'd go see a TPI certified golf teaching professional to get an assessment of both my golf swing and my mobility. Then, I'd go to some sessions with a physical therapist to evaluate me from a biomechanical standpoint, as well as a muscular strength, balance, and symmetry. Assuming they don't identify any major issues, it's quite likely that this will solve any pain or dysfunction after a period of time. Then, if I'm still not where I want to be, I'd find a physician like myself who understands both the golf swing and how to use orthobiologics such as PRP and stem cell containing bone marrow concentrate to help facilitate tissue repair and healing. Golf medicine, it's all about helping you return to play or continuing to play for as long as you want to play. By understanding common injuries, knowing who to see, and exploring the best treatments available, you can take care of your body and continue to play for years to come. Now, what's your biggest golf-related injury concern? Drop a comment below. I'd love to hear from you. If you found this helpful, give this video a like, share it with your friends, your foursome, your golf buddies, and follow for more golf health content. Thanks everybody. Have a great day.